Welcome back to the Means Report. Brad Means, glad that you're with us and happy to be talking about Graniteville. It's a special place to us long before January 6th, 2005, and it always will be. But our focus today is on the train wreck and chlorine spill that happened that fateful morning and all the people involved with life in Graniteville after that. And I have three special guests with me right now who are deeply involved in Graniteville and in helping that town recover and in studying the impact of that chlorine spill long term. After all, it wasn't just an incident that shut the town down for a few weeks and evacuated so many people, as we covered extensively here on News Channel 6, but it's an incident that could and is having long-term health effects. And joining me now to talk about their study on some of those effects are members of the GRACE project, that stands for Graniteville Recovery and Chlorine Epidemiology. It's a project that is studying actual individuals and the impact on their pulmonary system that the chlorine spill is having. And so rather than try to explain the clinical side of it, I'm going to get y'all to. Tina Bevington is here, Louisianna Wright Sanders is here. They're both community investigators with GRACE, and Dr. Erik Svendsen is the principal investigator with the GRACE project. Also, I should say that we have Dr. Randy Baker in studio. He's handling the clinical assessment for the GRACE project, and so if we need him, he can run up and take Erik's or my microphone and talk. But he made the trip here, and we're so grateful for Dr. Baker's participation in this important project. And Dr. Svendsen, let's start with you and just ask why you did this. Why not just let each individual in Graniteville who might be having an issue take it up with their physician or someone else? But why are you involved, and what are you looking for as far as these health effects we're talking about?
We're concerned that there might be some subtle changes in lung function that may not be detected without the continuous long-term monitoring that we are going to be providing for the next few years. We found in looking at the health department, we got access to the mill worker data, and looking at that, we found that in the years after the chlorine spill that there were slight changes in the rate of aging within the lungs. They were aging at 2 to 4 times the rate of aging that we would normally expect. It's those subtle changes in 1 year aren't enough to cause clinical illness, but if they were compounded over a long period of time, then they may likely have some long-term health effects. So that was provocative to us in wanting to look to see if that is still happening. It may be that people are better, but we don't know, and we don't know unless we bring them in, have them checked, and look to see if their lungs are aging at a normal rate.
And so is it just more for a study purpose to monitor and then be able to compile a report at the end of your project, or will you or might you be able to help these people?
Well, the focus of everything we've been doing from the very beginning is to see what we can do to help the people right now.
Right.
Of course, we can learn from something scientifically, and that is potentially a benefit. That's why we went the route with getting the funding through the National Institute of Health to be able to do this. But there is an immediate benefit to people who are going to be participating in this study. They'll be getting about $2,500 worth of clinical testing at Georgia Health Sciences University here in Augusta for 3 years over the 5-year period that we have the study. And that can provide them very robust clinical data about what's going on with their lungs right now that they may not be able to get in any other way.
Tina in Louisiana, let's talk to you all first for a moment here. Tina, you're from Graniteville. Do you know anybody who was there that morning? Were you there that morning, and have you met some folks who are having difficulty breathing ever since and whose lung function is worsening?
Yes. I live a half a mile from the actual site, and I was not affected myself physically. But that's my town, and that's my family there. Yep. And yes, I have been in contact with and know that there are people that are still suffering. Not just lung health, but other issues, but we want to try and start out what we can do with the lung function testing.
Well, we need people to take part. Louisiana, are you and Tina and others going door to door and saying you want to take part in this? There's clinical testing to be had for free. How are you pitching it to the community to get people to step up and help the GRACE project?
Well, actually, my relatives are all there. They live there, my siblings, my grandchildren, and my son and his wife. And they lived almost at ground zero. So my church is there. I'm there just about 3 days out of the week. So we know so many people there. I grew up there, I went to school there. So I know people firsthand who were impacted. Also, my brother worked at the mill for 40 years, and he was right there, you know, as an employee when this happened, and he lives almost at ground zero. So therefore, we know a lot of people already who we know that were impacted. These are friends, family members, community acquaintances, church members that we are all associated with, Tina and I. And we know so many of them, so we've been working with this for the past 6 years, ever since it happened, with a community organization. So therefore, we are very familiar with a lot of the people who have been impacted.
You know, I think that it's very important that you all noted that you're from Graniteville, that you have ties to Graniteville. It's not an outside study, even though it's federally funded. These are people who are a part of the community who are coming here and trying to help. Dr. Svendsen, who is eligible to participate?
This is a study that we have lots of people who are affected by this. We have mill workers, we have non-mill workers, moms, dads, children, elderly. It didn't matter. The chlorine just affected whoever was there.
Sure did.
Unfortunately, we don't have such great data to tie to for everybody. So this first study, we're hoping that we're going to get more. We can't guarantee, but if we could do this right, we're hoping that we're going to have one after another. So this first study is really focused on those mill workers, and we're asking that they give us permission to be able to link these data with the data that were collected from the time that they were mill workers when they had their lung function test done. They may remember going to be assessed, and they blow and do some lung tests there. So we're looking at folks who had 3 tests done during the period of time that they were working at the mill. And if they're one of those people, then they're eligible for the study. But if they're not eligible for this study, we would encourage people to contact us if they would like to get involved in other types of efforts that we're doing within the GRACE study community. We're looking for new ways to provide services and help these people every day. And so go ahead and sign up, and then we'd be happy to talk with people and talk together and see if you're eligible for this study, and if not, we'll keep in touch to let you know what else we might be able to help you with.
Tina or Louisiana, let me ask either one of y'all to respond to this, or you both can. Do you notice people who act and feel different now compared to pre-January 6th, 2005, where it's obvious that something bad happened to them when they breathed in all that chlorine that morning, especially, as Dr. Svendsen referred to, especially the mill workers? Do you see it every day?
I do. I have some friends who remain sick, and they haven't quite figured out just to put a finger on their health and what that health issue is, but many of them are related to their lung.
And I have family members who actually were severely injured during the chlorine spill, and they were hospitalized one brother was hospitalized for about 5 days in intensive care. So it's going to affect him for the rest of his life.
What does it do, the inhaling of chlorine gas, other than that initial burning and initial lung damage? What does it do that from which the body cannot heal? Why does this have such a long-term impact to anyone?
Well, the main concern that we have is, just like any type of burn, this is a chemical burn. When you get chlorine into the airways, in your upper airways in your nose and throat, and your lower areas in your lungs, you have the chemical burn. You have acids that are being produced from the chlorine. Those acids burn the airways. Now, if you get a burn on your skin, you might get a scar.
Sure.
If you get burning in your lungs, you might get potentially a scar. And so that's one thing that we're looking at, to see if it's potentially lung scarring that is causing these deficits in function. It may not be, but that's part of what we're going to be looking for in the clinical assessments here in Augusta.
I want people to take part, and I hope some former mill workers are watching, and I hope you can get in touch with them if they aren't. And take a look at the Grace Study Center's information there on your screen. You can go to the website, gracestudycenter.org, and find out how you can participate. And as Dr. Svendsen mentioned, even if you're not eligible for this first round, get your name on the Grace list, if you will, and be part of the project in the years to come. Or you can give them a call, 803-663-5004. As I mentioned in our first segment, y'all, this is still so fresh in a lot of people's minds, and it's refreshing to hear that you three and Dr. Baker and others are making an effort to help these people, and I appreciate you all doing that very much.
Thank you.
And I hope Grace is a huge success. I hope you spot problems and treat them, and I hope it just goes on, and the federal dollars keep rolling in as well to keep y'all going.
Thank you very much.
Thank you all for your time. Appreciate it so much. Helping out Graniteville through the GRACE project. When the Means Report continues, financial advice you can count on, how to continue to stay on top of this slumping economy and make the most of it with Jeff Fairman next.